Get started. Thanks everyone for joining. My name is Jake Reese. I'm the Associate Program Manager from the Michigan Collaborative for Type 2 Diabetes. We're very lucky today to have Rina Hisamatsu, our clinical dietitian for MCT2D, joining us to talk to you guys today about all of the different low carbohydrate diet resources that we have currently available, and some sneak peeks into some things that we're working on, and really kind of talking about how you can access them, how they can be paired together to really be able to be leveraged for clinical use with your patients. So before I turn it over to Rina, we're going to touch on just a couple of housekeeping items here. So Rina, if you can go to the next slide for me. So today's talk, as all learning community talks are, approved for CME through the Beaumont CME office. So if you are a physician or other clinician who does want to get CME for attending today's webinar, please text this number 71202 to the number on your screen by 1 p.m. tomorrow. So if you do not text that number, you'll have to go through the online system and create an account. So it's not the end of the world if you don't text it, but it is a little bit of an easier process if you do that by tomorrow at 1. When you text that number, you'll get a text back with the evaluation link, and you'll have until December 3rd to complete that. Next slide. So this is the CME credits that this learning community event is approved for. So we'll pause here and let you kind of take a peek here. So it is approved. Oops, we got some overlapping images here. Apologies for that. It is approved for physician credit, nursing credit, PharmD credit, and dietetics credit. All right. So for disclosures, so today's talk will be given by Rina Hisamatsu, who does not have any disclosures, but Lauren Oshman, our program co-director, does have stocks in publicly traded companies, and as well as diversified mutual funds that include Abbott and other clinical drug and device manufacturers. All right, so I'm going to go ahead and put a link in the chat. It's the same link that I put in the chat a little bit ago. For those of you that have joined since that, this is our sign-in link. So this makes it a lot easier on us to track attendance. This is really only needed for individuals whom are physicians participating in the Michigan Collaborative for Type 2 Diabetes. And that is just so that you can make sure to get the learning community VBR credit for attending today's meeting. So that is only necessary for physicians participating in that need that VBR credit. So that link is in the chat. We'll also be sending that out after the meeting in a follow-up email that will also include today's slides. So if you don't happen to, if somebody signs in after this, they'll still have an opportunity to complete that sign-in after the fact. All right. With that, I'm going to turn it over to you, Rina, to take us away and kick us off on today's topic.
Thank you, Jake, for the introduction. Hi, everybody. My name is Rina, and I am, oh, why is it not changing screens? There we go. All right, so I have the pleasure today of walking everybody through a presentation on the array of low carbohydrate eating pattern resources, and hopefully take you on a fun live interactive tour. We're going to be exploring MCT2D resources through the resource library, as well as the Jumpstart, utilizing our Jumpstart website. Welcome back to anyone who is already familiar with many of these resources, and welcome to new participants as well. Hopefully this will be an interactive and useful presentation to be able to implement some of these tools and resources in your practices going forward. We're also going to explore towards the end of the presentation some external low carbohydrate resources as well. So I'll be highlighting that. So first and foremost, we're going to dig into some of our home-based resources and look into sort of what we have available through MCT2D. But before we get into the resources, I wanted to first kind of set the background of the presentation. So, the title here is titled "Getting Patients Started." But in order to do that, I also, I think it's important for us to think about how can we as clinicians sort of better prepare and set the stage for gathering information or about the patients and make sure that we have the information needed to best help and provide resources for our patients. So that requires sort of taking that patient-centered approach, gathering background information about the patients, inquiring about their health goals. What are perhaps their goals as it relates to type 2 diabetes management, and eliciting interest in pursuing lifestyle changes and behavior changes, and even asking about perhaps what kinds of experiences they have with different strategies that they have tried in the past. And then sort of collecting all of that background information, we can also utilize some of the planning tools that we'll talk about today to guide in the goal setting process, as well as share relevant resources that can be most helpful for our patients. Some things to consider as we're kind of gathering, talking about sort of utilizing that patient-centered approach is, most importantly, who is going to have that discussion with patients and when. So, thinking about sort of as a clinician, as a provider, potentially, what are some of the steps that we can take beforehand to create the most efficient workflow so that we can have the most effective and helpful visits with our patient in the time that we have. So that might, look like sort of collaborating with other members of our care team, leveraging support from our nursing and MA staff, and leveraging their support during potentially the rooming stages to pose some of these, to gather some of the background information as well. So things that we might consider, asking our, talking with patients during the rooming phase and discussing things such as, our office is working on building a new initiative to better support our patients with type 2 diabetes care. And one of those initiatives is around low carbohydrate eating patterns. So really posing that question, is that something that you'd be interested to discuss with your doctor today? And based on sort of the responses, that could then sort of provide information as to let the provider know whether or not the patient is interested in maybe continuing that discussion during the visit. And so in addition to that, also figuring out other considerations would be to determine what type of learner the patient might be. So are they, do they prefer printed handouts versus are they more tech savvy and enjoy sort of online resources such as videos? Are they visual learners? Are they readers? Things like that are important questions or important things to sort of gather information around. And another sort of area for collaboration would be to utilize, maybe some of the most popular popular resources and well-used resources to have them printed and available, collaborating with the front office desk to have those printed materials available so that patients can pick them up and take them home at checkout, for example. If patients and if practices are more used to utilizing digital resources through like the after visit summary, potentially creating efficient like smart phrases can be one of the ways to build an efficient workflow as well. Thirdly, another consideration will be, how, to what cadence are we going to follow up with our patients, right? So this can be a great way to kind of check in with our patients, especially if it's sort of the part of their initial visit, initial discussion around low carbohydrate lifestyles. We could also sort of partner with care managers or nurses to contact patients a few weeks out from their visit to check in with them to see how the progress is going. When we're thinking about information sharing, I always go back to less is often more, that concept of less is more, especially for patients who are new to a low carbohydrate lifestyle. It can perhaps be more helpful to take a stepwise approach, consider maybe like relative change and sharing information in a gradual process to make it more sustainable for patients to pursue to achieve their goals and to work on behavior change, building healthy behaviors. All right. So the first major sort of resource that I'm going to be walking you through is the Jumpstart website. So what I'm going to do here, so there are a lot of, I'll tell you a little bit about the Jumpstart webpage, and Jake will also drop the link in the chat in case any of you would be interested in clicking through some of these resources together with me. But we have a lot of great sort of step processes for planning and goal setting that's available on our Jumpstart website. So some of the things that I'm going to focus on in this first area of the website is the planning feature or the planning tool. So under the planning tools, we have a lot of interactive features that where patients can set carb goals and as well as set goals that are related to their health, including their motivators, their physical activity goals. There are also different other features for planning, such as tools to track their carbohydrate intake, meal planners, and such. So without further ado, let's take a look here. I'm going to switch over my transition slide to this other web page. Okay. So some of you may already be familiar with the Jumpstart website. This was a huge endeavor, and I wanted to just say a big shout out to our design team and our web developer for all of the work in creating this website. This was initially created as part of the nutrition education component of the grocery delivery program called Healthy Eating Jumpstart. But from the very beginning, we had envisioned this to be a tool and a resource for patients long after the program is over as a standing long-term resource that patients can use to learn about how to implement a low carbohydrate lifestyle. So some of the features here that may be most helpful and in particular could be helpful to utilize as part of like the point of care tool is the goal setting feature. So if we take a look here on the top right-hand corner, these are going to be all of the tabs that you can take a look to see what features and pages are available on this website. So if you go under the planning tool, we'll see here a set of different processes that helps patients walk through the different steps to implementing a low carbohydrate meal plan. And I'm going to click here on setting goals. So this is a really great feature because it allows, it can be used as part of the patient care during conversations with patients, especially to determine maybe what the right carbohydrate goal or intake goal would be for that patient. Upon determining the carb goal, so this is very interactive in that you could walk through this with your patients if you are in clinic, or also encourage patients to utilize this website to write in their own sort of additional goals here, such as their motivations for making lifestyle changes, how are they going to be tracking their blood sugars, how many times a day they'll be checking, as well as their physical activity goal. The nice thing about this page here is that once they've written in all of their goals, you can actually download it as a PDF. You can even print it. So again, the printing can be helpful, especially in a clinical setting. If they wanted to, you can quickly note down the patient's goals during the clinic visit and have them printed so that patients can take them home at checkout. Next up, patients can also, I think a lot of the next steps to the planning phase here, these are all tools that can be, that we can encourage our patients to explore and utilize, in their sort of at home as well for additional information. So the next point here, these are different tracking tools. We have examples of digital tracking tools that are available here, as well as our MCT2D paper tracking tool. So this is the weekly carbohydrate and blood sugar tracker that can also be downloaded through this website. All of these resources are also available in our resource library on the MCT2D homepage. So I will also show how to access those tools there as well. The next part, the next step in building or in implementing a low carbohydrate lifestyle is to kind of walk through the steps of building a balanced low carb meal. So again, this is, the intent behind this website is to really make it as user-friendly and interactive as possible for the patient, and just a fun way to learn. So this is very interactive in that the person can sort of click through each of the steps, and with each step, it has further information and details about what foods that they may consider incorporating. Patients can also make their own meal plan using the recipes that are on our Jumpstart website. So that's the next step here, making a meal plan. If for folks who are interested in kind of having a sample meal plan to review and get ideas from, we do also have the 7-day sample meal plan that they can download directly from this website. As I had mentioned, a nice feature about this website is that they can create their own meal plan or generate their own meal plan by adding in recipes from our library archive. And so as you can see here, just as an example, so just a quick note here, there's lots of filtering options on the left-hand side. You can filter by type of meal, carbs per serving, the type of protein source used. For our sort of purposes today, I'm just going to show you an example of what can be created. So I'll just add in here a few recipes. And what this feature does is you can, once you've got your recipes for each day, you can add a new day and add more recipes to it. Again, it's just a fun way to generate your own meal plan. And if you click download my meal plan, it converts it to PDF. You can either save to PDF or you can also print it as well. All right, and I think the last part on the planning stage here is the sample grocery list. So here we have the interactive part about this grocery list is that you can hover over the different sections of the grocery list to see what are some of the foods that are in these different categories. So this is meant to be a canvas for ideas for low carbohydrate groceries that individuals can use to create their own shopping list or take that list with them. And I often encourage patients to highlight different foods that they might like on the list to help remind them to know what to get at the grocery stores as well. All right, so I will take you back to this Jumpstart website. We'll kind of go back and forth with each section. The next part I wanted to share with you all is the homepage for MCT2D resources. And the main things I'm going to be highlighting in this next section is the resource library that is found in our MCT2D homepage. In particular, I will be featuring I'll be highlighting the bookmarking feature as well as the collections tab. All right, so without further ado here, I'm going to swap over to the MCT2D website. And my cat has decided to join me in this call. Okay, all right. Alrighty, so now we are on the MCT2D homepage, and again, Jake will drop in the chat the website in case if you would all be interested in clicking along these different sections with me. There's a lot on the homepage, a lot to explore, but for the purposes of today's talk, we're going to focus on the resource library. So I like to use these speed buttons here to get to my resource library. And so if we click on this button here, it'll take us to the resources. The resource library has all resources related to all three of the initiatives. So not just low carb, but also CGM and medication related resources. Today's talk is going to focus on mainly the low carb resources. These speed buttons here also allows for that quick filtering of the resource type. I'm going to select low carb here just to provide a few examples. Um, uh, this next feature I'm going to present is something that I find really helpful and I hope will be helpful to some of the listeners today, and that's the bookmarking feature. So the bookmarking feature allows you to really kind of add all of your favorites into one page. So if you have tools and resources that you know you use very frequently or something that you share quite often with your patients in practice, you could actually bookmark it and make sure you've got easy access to those resources. You can, of course, bookmark it directly as a favorites on your web browser, but this is just another layer to that if you wanted to use it. So I use this very often. To use that, there are two ways to bookmark your favorite tools. So you can simply click the Add Bookmark tab here, or you can go into the resource and click on Add Bookmark. So once you see this orange check mark, now if we go back to the resource page and click into my bookmarks, it should be now available for you to easily access this handout. All right. The other feature that I wanted to share with you all is the collections page. So right above the collection page, we have some other tags for filtering. Below this is also another sort of feature. These are pre-filtered collections of different resources based on a specific theme. So for example, we've got starter packs for low carb, patient-facing tools right here. We also have a collection of all of our low carb sample meal plans. If we click on that, we've got our videos, all of our low carbohydrate videos here, and many more resources. One thing to note about the filtering process is to make sure to deselect if you are going to switch to a different collections, or else it will compound on each other and then end up with no results. So I've made that mistake quite a few times. So make sure to deselect every time you're trying to choose a different collection. All right. So next we'll take a deep dive into the different or the specific resources within these, within the two websites. Okay. So I'm going to introduce some of these resources in more detail over the next few slides. These are what I find to be helpful resources to share with patients during either the initial visit for a new patient or even at follow-up visits, just based on how much, what kind of information you're sharing with patients at each of the visits. So if you're doing kind of a gradual stepwise approach, these can also be sort of distributed with each of the successive visits with your patients. So we've talked already about the Low Carb Jumpstart homepage. I'll show you the other features as well as we go through each of these sections. We have talked about the goal setting tool or the goal setting planner feature. Next up, I also want to introduce to you the Intro to Low Carb one-pager. So this is actually a really popular tool that's used by many of our practices. I share this very often as well as a point of care tool for patients who are interested to learn about a low carb lifestyle. So this handout is helpful for patients who are new to this approach and interested. They want to learn a quick overview about this approach and tips on how to get started. It can also be helpful to share this handout to patients who are maybe on the fence. They maybe have some uncertainties about whether or not this would be suitable for them, but they're willing to learn a little bit more. So they wanted just some overview about what this approach is all about. This could also be a helpful tool in that case. So this handout or this tool has information. The really nice thing about this tool is that it has a lot of visual representation. So as you can see from the slide, there's comparisons between low carb and high carb meals, explanations about the benefits of a low-carb lifestyle, as well as the differences. If you actually, the second page of this handout has the differences in how blood sugar responses to a high carb versus a low carb meal, as well as tips and strategies to get started on this approach. All right. So if you have patients who are, sometimes we have patients who are really interested in this approach, and also they are really motivated and want a lot of the information up front. So in those cases, we have this kind of a summary of all of the different information to get started in this welcome packet that's available in the low carb Jumpstart website. So this is a more comprehensive all-in-one packet of information about initiating a low carbohydrate lifestyle and includes all of the basics of transitioning to this approach. So meal planning, resources, tracking carbs, information about nutrition labels, etc. So that can be found on our low carb Jumpstart website. We go back to home. There are two ways you can go back to the main page. Either click on the home button on the top right-hand side or click on this icon, cute icon here. So on the main page, there is a button to download the welcome packet. So if you click on this, it will take you to the packet to download. So you can save this as a PDF, or if patients would prefer, they can have this printed out either at the clinic or at home. All right. So next up, I'd like to share with you the Intro to Low Carb video series. So this is a three-part video series, and it was created in response to a request that we received from one of our physicians from the collaborative. He was looking for a video resource that he can share with patients during clinic visits as a way to reinforce some of the discussions around low carbohydrate eating patterns that he was having with his patients. Because, their time was limited in terms of how much he could have that discussion with patients. So he wanted that additional sort of resource that patients can take home with them and watch in their own time to help build their understanding and empower patients with the knowledge and tools to initiate this lifestyle change. So this resource can be helpful for patients who enjoy watching videos, prefer maybe a video format over a printed tools and materials. And also similar to how the physician was using this, it could be a way to reinforce some of the conversations that you have in practice. So we also, related to the three-part video series, we've also created a quick access guide for the three-part video series. Quick shout out to the design team for the quick turnaround of this handout. But we created this because we wanted we know that not all practices have utilize like digital information sharing, like through the after visit summaries and through the portal. So some practices may prefer to have printed materials to hand out to their patients. So in those cases, something like this could be helpful because it has the quick access guide to each of these videos using just a QR code that patients can scan using their phone. So print, share, scan, and watch. And it has a little blurb about each of the videos, as well as the length. So these videos are generally about 10 minutes long. So we think it's can be a bite-size length for information sharing. All right. All of these resources are going to be available in our resource library on the MCT2D homepage. The links to each of these handouts are available on the slides. So I won't be sharing them I won't be dropping them into the chat for during this visit, but I just wanted to note that when we share the slides after our visit or after our presentation today, you should have access to each of these links and resources. All right, so when it comes to meal planning basics, so we have two different handouts for available here. So one is the 4-step process to create a balanced low-carb meal. And then the other one is going to be the 3-step process to create a very low-carb meal. So we have patient-facing handouts here as well that can be downloaded and printed and distributed for those interested. The Jumpstart website, as I had shared earlier, has that interactive tool, which I personally really like using during patient visits to make it more interactive as well. All right, so this is the 3-step process to building a very low carb meal. All right. And then this as well is, so this is the same low carb grocery list that I had shared with you that was part of our Jumpstart website. The intent for this grocery list is again to serve as a canvas for ideas and inspiration that patients can use to sort of find examples of low carb foods within the different food categories based on their preference and what they like to eat. So I oftentimes, when I use it in clinic, I recommend this to patients to use it as a meal planning tool when they're writing a grocery list. They could highlight the different foods that they see on there to pick up at the grocery store, or they could use this to create their own sample grocery list. We're also in the process of creating a vegetarian version of this grocery list, and that's going to be coming soon. All right. So nowadays, there are a ton of recipes that you can, low carb recipes in particular, that you can find, that you can Google search on the web these days. However, we wanted to make this a little bit easier for practices and your patients as well to have access to easy low carb recipes as a place to get started. So we curated a library of low carb recipes on our Jumpstart website with some things in mind. So we wanted these recipes to be relatively simple to make, accessible to a variety of different budgetary needs and kitchen resources, low in carbs, and of course, tasty as well. So we currently have over 50 recipes, and we're continuously working to add more to this page. So on these slides, I just provided a few examples of the recipes for breakfast, lunch, and dinner. And I'll show you in just a moment where you can find the recipes on our Jumpstart website. Typically when I'm talking with patients about meal planning and recipes and what to make as a low carb meal, I try to sort of understand first, what are what's the patient's sort of baseline dietary intake? What are their usual foods? What are some of the common foods that are part of their eating pattern? And use that as a framework to make recommendations for, to swap out for lower carbohydrate options or to transition, to transition one meal at a time. So I often do work with patients and recommend sort of that transitioning one meal at a time approach because it's oftentimes a more approachable, stepwise process and may feel less overwhelming for patients as well as they are, making dietary and lifestyle changes. And so, for example, a lot of my patients say, I think changing breakfast would seem, most feasible for me right now. So oftentimes we go with sort of brainstorming ideas for breakfast, for example. For example, switching, let's say, cereal for scrambled eggs and veggies, or a bowl of Greek yogurt with nuts and some fruit. So simple ideas based on what patients are telling you about the foods that they commonly eat can be a good place to start. So where do we find these recipes? It's on the Jumpstart website. So let's go back to the website. I'll go back to the home page first. So if you take a look on the right-hand corner again on these tabs, the recipe library is going to be under the cook page. So if you click on cook, it will take you to all of our recipes. And similar to the meal planning section, you can filter the recipes by the type of meal, the type of protein you're looking for, carbs per serving, prep time, cost, etc. So if you click on any of the recipes, it will uh, provide information about the recipe itself as well. All right. Many of these recipes actually were submitted by members of our patient advisory board. So a lot of, many of these recipes have a story behind them, which I think makes it all the more special and unique to our webpage. All right. So we also have built some sample meal plans for patients to take a look at if they wanted some ideas on, getting started on maybe like what a low carb lifestyle might look like. So we first created 3 base sample meal plans, a 7-day low carb sample meal plan, a very low carb sample meal plan, as well as a vegetarian low carb meal plan. All of the sample meal plan is also available in the collections page on our resource library. So you can scan the QR code if you wanted quick access to that as well. And I'll show you in just a little bit, we have we have also further expanded into culturally influenced sample meal plans as well. All right. So one of the important elements to having success and being engaged with a low carb lifestyle, I think, requires sort of an understanding of first macronutrients and carbohydrates, and also to build that skill of keeping track of carbohydrate intake in order to maintain one's carb goals. And so in the following slides, I'm going to be sharing some educational resources that could be helpful to share with patients for that education, for sort of that introductory, like base education around carbohydrates and tools that can be helpful to support carb counting. All right, so this is a blog post that is available on the Low Carb Jumpstart website. It's one of the many blog posts that we have available. We created the blog website or blog page on Jumpstart as a way to address, frequently asked questions by our patients, adding, tips and tricks and different, themes and tools around low carbohydrate eating patterns. So this blog provides an overview of macronutrients, explains what types of foods contain carbohydrates, proteins, and fats, examples of, there are also visual aids around carbohydrates and how many carbohydrates those common foods contain. So can be a helpful sort of informational blog post to learn more about macronutrients. All right. We also have another handout. This is another patient-facing handout explaining how to sort of review and understand the nutrition label of packaged foods. So this is available in our resource library. There's information about how to identify the serving size, carb content, fiber, as well as protein, and descriptions about what that entails and what that means. And so this can also be helpful to help patients understand how to identify carbohydrates in packaged foods. All right, we also have a low carb cheat sheet. So this is a quick reference guide for carb estimates for some common foods. So it's not an exclusive or exhaustive list by any means, but we created this as something to get started, right? To provide some ideas as to some of the common high carb and low carb foods with some carb estimates for them. All right. So we've got some carbohydrate tracking tools here listed. So on the left-hand side, or sorry, right-hand side, we've got MCT2D's weekly carb and blood sugar tracker. So this is a really helpful tool. It's for patients who prefer kind of that pen and paper method to keep track of their food intake, and they can also sort of see how how foods impact their blood sugars as well. So the nice thing about this is that it pairs their blood sugar together with their food intake, and they can kind of keep track of their blood sugars throughout the day. On the left-hand side, we have, this is an external resource, so it's a pocket reference guide for the nutrition content of many common foods, and it includes fast food options. So some of my patients have found this to be a helpful resource. So we're including it here as well. There are also many digital tracking tools, as we noted earlier. Nowadays there are many different types of tracking apps that patients can download on their smartphones. There are many, so we're just pointing out a few that are common and popular among our patients. And yeah, this for folks who prefer more of that digital option and don't want like a paper trail of their food intake, this could be a better option if they prefer a digital tracking tool. All right, next we are going to dive into some resources which are tailored to better meet the diverse needs of the patient populations that we work with. So I wanted to share with you this booklet called Celebrating Food Diversity. And we recently published this. It highlights some of the low carb adaptations of meals which are influenced by the diverse global cuisines and regions throughout the world. I will show you sort of what it looks like on the inside. It is available as well in our resource library. So I'll flip over here. And this is the tool right here. So if we take a look here, so it goes through the different culinary travels around the world, examples of lower carb alternatives and strategies to be more carb conscious. And so also we highlight some examples of low carb foods within these cuisines as well. All right. So as an extension of the sample meal plans that we've created, we have also collaborated with community leaders to create culturally influenced sample meal plans. We currently have 3 different kinds. So we have a South Asian sample meal plan that is vegetarian, as well as a non-vegetarian version. And we also have a Hispanic low carbohydrate meal plan as well. So we're working on future collaborations as well to expand our resources here too. So all of these sample meal plans are available in the collections page of the resource library. All right, so furthermore, we've also created different renditions of low carbohydrate meal planning that are tailored to different scenarios. So here we have some examples of resources for shopping low carb on a budget. On the left-hand side, we have an external resource. It's a booklet with meal planning strategies and how to cook low carb on any budget. On the right-hand side is another example of a blog post on our Jumpstart website. And This blog post was really fun to write. It has a roundup of the different types of low carb groceries that is available in the common dollar stores in our community. And so let me actually, I'm going to take a pause and show you how to get to the blog page. So once again, all the blog posts will be on the Low Carb Jumpstart. So if we go to the home page, it's going to be under the Learn section here at the very end. And if we click on blog, it will take us to the blog site. So this has the entire collection of all of the different blog posts that we currently have. All right. We also have, further expanding on the blog posts, we have also created different types of, or different blog posts based on sort of how we can implement a low carbohydrate lifestyle when we are busy or on the run or on the road. So we have examples of, we did a really fun sort of blog post about where we taste tested common low carb protein shakes on the market, and we ranked them based on our preferences and what we thought tasted the best. And so we have examples of that for folks who are looking for some low carb resources and tools that they can take with them and help them with meal planning when they have busy schedules or are on the run. We have tips and tricks and strategies for eating low carb on the road. And we also have examples of low carb fast food options as well. The next page, low carb snack options. So this is another, one pager handout with just a few snack options that are low in carbs. This can be a helpful, a helpful handout to share with patients who are looking for examples or ideas, and can also be a great tool for folks who are looking for things that they can take with them that's portable when they're out of the home for most of the day. Okay, this next resource is another blog post, and it's about how to navigate low carbohydrate eating and lifestyle, and how to navigate that during the holiday season or during social gatherings. We have tips and tricks on how to navigate those situations. And it may be especially relevant now as we are going into the holiday season. All right. Okay, so next up, we're going to be reviewing a few provider-facing resources. Okay, so we have what's called a resource menu poster. And so this poster is, it's a clinic poster that has the QR codes for quick access to some of the most popular resources within MCT2D. We are actually working on creating an ordering system for practices to request bulk ordering of these posters that we will mail out to you. For right now, it's available on our resource library, so to download and print. But we're also in the works to create MCT2D keychains with these resources on them. So that was actually an idea from one of the practices who was implementing that strategy. They were laminating each of these sections of the poster and turning them into keychains that patients can flip through in the waiting room. So our anticipated we anticipate that this poster ordering system, as well as the keychains, to be ready by sometime in December. All right. We also have past learning community webinars for clinicians who are looking for a refresher on low carbohydrate eating patterns and operationalizing this approach in their clinic. Dr. Grazda also presented recently on how to support patients with type 2 diabetes using continuous glucose monitoring and carb restriction. So check these out. The links are also on the slide. Oh. All right. The ADA has some free continuing education courses for clinicians, similarly sort of converging how to support patients through sort of making healthy behavior changes together using CGM data. They have, additionally, they've got resources that can be downloaded and printed, both provider-facing and patient-facing. I really like the provider-facing handout about nutrition conversation starters. It's a great way to sort of, will walk you through sort of how to utilize CGM data at specific parts of the day, sort of what they call areas of focus, to have that conversation with patients to initiate and encourage behavior change utilizing that CGM data. And then there's also a patient-facing tool on the right-hand side. Okay, we also have through MCT2D, we have a one-on-one RDN consultation services. That's an additional resource for clinicians where you can schedule a 15-minute consultation with me to discuss anything related to low carbohydrate eating patterns. We can discuss specific case studies if you have questions around it, any strategies around implementation and counseling. So we have spots available in November and December, so you can use the link to schedule a consult if you'd be interested. Okay, a few exciting things, a sneak peek into some things coming soon in 2025. So one of them is the low carbohydrate diet training workshop. What exactly is this? So this is going to be, we are planning this to be a 1-week long virtual immersive training program. So we're envisioning this to be about an hour long over the course of 5 days, an hour each over the course of 5 days. And it's designed to teach clinicians on the foundations of a low carbohydrate eating patterns and how to operationalize this approach in practice. The target audience is for all clinicians, so physicians, APPs, nurses, MAs, pharmacists, and more. So we are currently developing this tool or this program, and we are very excited to launch this in the spring. Next, another exciting tool and resource that's coming out soon in the spring of 2025 is the MCT2D app. So the MCT2D app, some of you may have already know this from the regional meetings. But so the MCT2D app is a provider-facing app that's going to be useful to access tools and resources that can be shared with patients. Some of the other key features as well to the MCT2D app is that you'll have quick access to all of the latest news related to the collaborative, upcoming events. There will also be a coverage checker, a light version of that, where you can see whether sort of medications or CGM is covered based on different insurances. All right, in terms of the resource library, so the cool thing about the MCT2D app, or what we're building in as a feature, is that you'll be able to sort of review and kind of see all of the different types of tools and resources from the 3 initiatives. Providers will be able to view, select, save, as well as share those resources with patients as part of the point of care tool. So you can simply text the tool or email the tool or copy the link and paste that to your note or any relevant way to send the resource to your patients. The good thing to note here is that the patient's phone numbers or emails will not be saved, and neither will the provider's information. So that's just wanted to make sure that that was clear. All right. We are also working on revamping the the low carb jumpstart website. So we are making some revisions and updates to all of our tools and some of the graphic designs. And so that will be coming in the new year as well. All right. So lastly, the last section is going to be about some external low carb resources. Many of you may be familiar with Diet Doctor. So Diet Doctor is a website that has a lot of information about low and very low carbohydrate eating patterns. It's also has a lot of great visual tools for patients, including meal plans and recipes and videos. So I wanted to highlight this. One of their new tools that they have is called the Food Navigator, which acts as a visual aid. They have, the carbohydrate content of many of the common foods. They also have, you can switch between carb content, protein content, and what they call the satiety ruler as well. So I thought that was interesting as something that I found recently as well. Another web resource that I would like to share with everybody is a website called Eat the Butter. The reason I really like this this is can be used as a patient-facing tool. I really like the visual aspect of this website, and I will take you to the website in just a moment to show you their resources. But they have a lot of visual meal plans. To create balanced low carb meals. They use what they call the ABC method. So A for adequate protein, B for bright veggies, C for conscious carbs. And then they have a lot of different pairings of the ABC options to create really beautiful visuals. So let's take a look here. These are some of their sample plates. Oops, there we go. All right. So again, there may not be time to share this with patients during the clinic visit, but again, I think this could be something that can be shared with patients and encourage them to sort of explore and take a look on their own for ideas and inspiration. And what I really like about these visuals is that it makes low carb meal planning look, it tries to simplify the meal planning process. And it's presented beautifully as well. So wanted to share that. They also have an interactive dinner plate planner. Let's see if we can get to that here. Yes. So they do have an interactive dinner tool, which is also a really fun tool to use, where they can, once again, create their balanced low carb meal by sort of switching through, clicking through the different options of the protein and the veggies and some of the conscious carbs as well. And they have a new feature where they have dinner ideas for very low carbohydrate meals as well. All right. We have further additional sites for low carb recipes. We know that there are a ton out there, but these are just a few to get patients started for additional information. The Diabetes UK is the UK version of the ADA, and they also have a lot of tools and resources around low carb meal planning. So I'll be sharing the link here. They have sample meal plans and recipes as well that can be great for additional ideas. And lastly, I wanted to share this resource for practices that work with patients who observe the fasting month of Ramadan. And the DAR Alliance has a really great booklet of evidence-based practice guidelines for managing diabetes during the fasting month of Ramadan. So it includes not only nutrition considerations, for patients who are fasting, but also any considerations for med changes and such. All right, so that is all that I have for you all today. I know that I kind of whizzed through everything, but I know we have maybe just a minute or two here for questions. Yeah, thank you all for listening. Are there any questions or anything that you'd like to ask? Let me check the chat to see if there's anything here. Okay, so I see a question from Orlando, how soon will the keychain be available? So we're anticipating those keychains. We're going to pilot it out sometime in December. So look out for that coming soon. And then Frankie, can
Real
we
quick on
get
the
the
keychains, yeah.
posters?
We're going to open an ordering form for that. The idea is that we're going to send out some samples to the POs. At this time, our order seems to be bouncing around the mail system. So kind of unintentional delay there. So apologies for the delay, but we are waiting to get them delivered as soon as the postal service figures out where it's at.
Thanks, Jake. All right, so let's see. There are a few more questions. Can we get the posters of the meal samples? Frankie, which meal samples are you referring to?
The ones that you just showed that had the different combination and had the plates, the multitude of plates with different recipes.
Oh, okay. From the external website, was it the Eat the Butter website?
Yeah, we're creating an educational room, and I think that's perfect to be able to
Okay,
visualize different combinations and possibly
sure
have
thing.
access to the recipes, right?
Sure thing. Yeah, let me actually drop the link in the chat. This will also be, the link will be available. The link will be available when we share out the entire presentation. So all of the links should be on the slides for you after our presentation today. But I also did drop the link in the chat for access right now. Okay. So Sally, so the 16-week video, the 16-week program. So I believe you are referring to the low carb journey. So thank you for bringing that up. We are the low carb journey is a 16-week based self-guided program for patients, teaching patients how to follow a very low carbohydrate meal plan. So we are currently, that program is available only through select Michigan medicine clinics. It's not part of MCT2D yet. And so we wanted to sort of share, we brought that up in the regional meetings to gauge from our audiences and from our practice whether there is interest in MCT2D developing something like that for our practices in the collaborative. And so there was actually an overwhelming interest in having a similar program. So what we're going to be doing for as next step is to bring that back to the team and then discuss how we can, move forward and make that available, make this program available for our practices. So more to come on that, and we'll definitely be sharing more information as we know more. All right, let's see. Sharon, the recipe website page. So I will be sharing all of the slides in the when we share out the slides at the end of the presentation. So that will include all of the recipe links as well. Okay, Stephanie, let's see. Last question here from Stephanie. All right, let me share my screen again. So your question is, can you show how to build a patient's personal menu? That's on the Jumpstart website, I believe. So let me share my screen again. Okay. All right, so if we go into the Jumpstart website, I'm going to go back to the home page. So the meal planning, the interactive meal planner, and building your own meal plan is going to be under the planning tools. So build a meal is going to be the interactive 4-step process. This will teach patients how to use the 4-step process to create a balanced meal. And then if you go on to the, if you go into the meal plan, this is where they can select and generate their own meal plan using the recipes from our recipe library. So if you scroll down, this is where I'm going to delete these. So patients can essentially just click on whatever recipes they see that they like. For example, broccoli tots, ratatouille, and it should add to the state. You can actually add a new day and then add recipes to that as well. So you can create your own 7-day sample meal plan as well. I'm just going to put an example here. To generate that meal plan, what it does is you basically click on download my meal plan. And what it does is it will convert that into a PDF file. So it essentially consolidates all the recipes. Unfortunately, it's not able to combine all the ingredients together, but it essentially will just put all of the recipes into one PDF file, divided by the day. All right. So we are working, as I mentioned, we're working on revamping the Jumpstart website and making, continuing to refine and make it as user-friendly as possible. All right. I think those are all of the questions. Thank you all so much. I know we went a little bit over time. Please reach out if you have any other questions. Reach out to me reach out to me directly or to our coordinating team if you have any questions going forward. But thank you all so much for your time, and have a great week.